Definitely when it comes to transgender people, your hormones are very important to you. It's a priority. And so you begin to negotiate, well, should I take the blue pill or should I take the blue pill? You know, and so you're like, well, is this affecting my health? And if there was an easier way, I mean, you know, you have like these PrEP studies, injectable PrEP studies, I guess, but a lot of trans people have like silicone injections. So then they would not be able to get those kind of preventative measures because they are not, they're not allowed because of the silicone injections. A lot of people don't even know what PrEP is. Like a lot of people don't even know what it is. Like a lot of heterosexual cisgender people that I talk to don't even know what it is, especially in communities of color. They really don't know what it is. They have no clue. I don't know if the signage, either the doctors are educating them and talking about it, or if the marketing isn't translating to something that they can like look at and be like, okay, I don't know where the barrier is, but there's definitely a barrier. I know for trans people, one of the barriers is what are the side effects? Because, you know, I'm already taking hormones. So what are the side effects of taking this HIV medication in a preventative, you know, aspect? Then there's also PEP, you know, which is post-exposure prophylaxis, which I had to recently go through. Problem was that it kind of, you got that 72-hour window, and it was kind of like lax in the question part. Like first it became kind of intrusive, asking what kind of sex I had, and or, you know, how long when did we do it and all that kind of stuff, which was like intrusive, and I just didn't feel like answering it. And the same when it comes to being tested. I always ask to just do it anonymously because the question part is so like, which I know that for statistical and data and research purposes, a lot of those numbers are needed to ask if the sex was for money, or to ask if, you know, if the sex was, you know, consent, just all the questions that they ask. Some of the questions feel intrusive. And so you instantly, even though it's a part of the prevention and the testing process, you know, you answer the test, you take the test, okay, you're negative, this is what you do, okay, you're positive, this is where you need to go. It can be intrusive. When people ask you what kind of sex you have, that it just can be kind of intrusive because, you know, a lot of trans people, just because they're trans doesn't mean they want to be topped by men. They may top people themselves. You know, they may engage in vaginal sex because they may still be attracted to cisgender women, or maybe trans attracted themselves. And so I guess understanding, or doctors being confident that just because someone's trans and trans feminine means that they want a man to have sex with them. That is just a myth. That's not the truth, because as we all know, gender identity and sexual orientation are mutually exclusive. So people oftentimes couple the two, which can be kind of dangerous. That's when you have the situations going on, like where people think that trans men only have sex with women, but a lot of trans men are homosexual and have sex with cisgender men.
Some people might feel as though it's kind of embarrassing to talk about physical attributes of your physical body that hasn't been, like sometimes if they may ask sexual questions or like evaluation of something, they may feel uncomfortable with talking about that, but I think that's probably the only thing. Some people probably just might distort the truth to not sound as bad. So I think that in order to fix that, there needs to be a level of comfortability. Respect has to be given, because just as sure as anybody else that's not trans walk into a doctor's office or anything, as soon as you can kind of feel the shift of energy, I think, or feel. So there has to be a good energy and with the person who's doing the screening and stuff. And also be a little more personable. Leave your attitudes at home, I think. And then, like, the main thing is the gender mark and misappropriating someone's gender mark and calling them the wrong. You know what I think needs to happen? There needs to be some type of, I don't know if there's a evaluation that people who have ill feelings or stigmas towards people of trans experience should not deal with trans healthcare or be in the secretary's office, or be, because you know, sometimes you get the person that you meet before you get to the person that does the screening and testing. I think there needs to be some type of training not trans but gender sensitivity training with that team. I feel as though I wish it could be a little more. I know it's kind of a thing where if some girls go into a clinic and see other girls there, they won't go because they don't want them to know. You know what I mean? There's a level of privacy that, I mean, it's sometimes it's a lobby, so you can't, you know, and it's a specific, people know what a certain clinic is for. So if sometimes a girl sees another girl in the lobby, they're not even gonna go in because they don't want them to know. And I don't know if it probably would be too much to do private treatments and screenings and stuff. I'm pretty sure that could be costly, but maybe another level of privacy protection